see, first, don't normalize period pain. Listen to your girls when they tell you they're in pain. You see, anything that affects you as a woman from doing your daily activities is not normal.
Yeah.
Period pain is there, yes, but then if it affects your daily activities, it's not normal. You see, with endometriosis, the blood doesn't really necessarily flow where it should. It goes outside of the endometrium. You see, it could be thoracic, like for some people we know in the country, not to mention names. So
I think you can mention, because she's an ambassador of that.
Yeah, we have Jambi Kwekai. A few of you people know her.
Yeah,
She's
you see,
really battled with that.
She's had a rare condition, which is thoracic endometriosis.
Yeah.
So the blood flow is outside her endometrium. It goes to the lungs.
You know, you're assuming that we're
the endometrium is a layer of the uterus. Yeah, you see, how you have your periods is the contraction of that wall and the shading of it.
Yes.
So for her, it doesn't happen normally like it should. It's at the lungs. That's why she has a rare condition known as thoracic endometriosis.
Ah, so it's basically having the endometriosis.
The shade outside the endometrium.
Outside the
that
wall,
layer of the uterus that should be shaded. So it's not inside that region, it's outside. It could be anywhere, which is so rare anyway. Now you see, now we have more girls experiencing the same. People assuming it's period pain, deal with it. Painkillers, they're not working. You can't have this every time. They're actually not working. You see?
I have a question. You know, when you say we should not normalize period pain, it can be a bit confusing because the way that we understand period pain, it means that for the lining to shed, there's got to be contractions, and when there's contractions, there's a bit of pain. So you're saying that there should be no pain at all, and then I'm wondering, thoracic endometriosis, was the pain like around the chest, or was it all around the womb? You know, this area.
When you talk about don't normalize this pain, we all have this pain. Not all of us. Some people actually don't experience pain at all. So, but for those who experience it, they could actually still carry out the activities.
Yeah.
But when it's affecting your daily activity, you can't go to work, you can't do anything, then it's a concern.
Yeah.
Probably you should see a gynecologist. So when it's a concern is when it affects your daily activities.
Right.
That's when they talk about don't normalize this pain. Women themselves should listen to their bodies.
Yes.
And tell this is normal, this is not, what's the progression, how do I feel about this? You see, and communicate and see a gynecologist. And then when we talk about thoracic, you see someone like Jambi had accumulation of fluids at her chest because her shade was where? At the chest cavity, the thoracic cavity. Yeah, you see. So instead of the uterus, instead she could collapse. I've heard a story. She could collapse sometimes out of pain. No one understood this. Understood the experience. They're like, you're having periods. It's normal. There's no treatment for periods. Why are you actually complaining?
A lot of women say to the women who say they have a lot of pain, they say, I also used to have, but mine ended. Or I also have, but I usually take ABCD painkiller.
But you see,
they even have you to normalize it. They encourage you to
me too.
Me too. Guess what I do? Take this. If it doesn't work, get a stronger one. You know. And you know, you're thinking that you're giving good advice, but you're actually preventing somebody from seeking medical help.
We have different experiences.